We're going to unpack all of this with Dr. Emanuele Capobianco from the International Federation of the Red Cross and Crescent. He joins me from Geneva. Doctor, great to have you on the program. Now, the Delta variant appears to fast becoming the dominant strain in so many countries. We know that it does really seem to spread faster. How deadly, though, is it, especially among unvaccinated populations?
Well, we know that it moves very, very fast. It infects many more people at a faster speed. That's clear. In terms of how more deadly it is, the science is not yet conclusive. We know that more or less the mortality is similar to the previous variant, which means it is a very deadly virus. And hence, the need to take protections to avoid the spread of the infection. First, to ensure vaccination gets going as fast as possible in all countries. Second, keeping all the public health measures, masks and isolation and the ventilation and washing hands in place for the medium long term.
So let's talk about those countries that have had very good vaccination rates. Europe, the UK, the US, many of those places have fairly opened up, especially to tourism. Do you think that they've opened up too soon, though, especially with the Delta variant going around?
So we need to have very high vaccination rate, around 60–70% of the population, in order to ensure that we're not going to have explosive outbreak. Anything less will probably lead to large outbreaks. And we are seeing in countries that have opened numbers going up very, very rapidly. Now, it will be infecting primarily young people, the variant, if the vaccination rates are high. But there is the risk that many that have not been vaccinated, even in the older groups, will eventually get the vaccine. So they will eventually get the disease, so getting infected and potentially dying. So opening up too early, too fast, and releasing the public health measures that are sensible is a very high risk that countries should not be taking unless they want to face what is going to be a very high surge of infection and very likely a high surge of mortality too.
Well, actually, we've seen some countries in other parts of the world, I'm thinking South Korea here, Australia, ones that we've mentioned in this bulletin, that had been praised in the past for their containment of the virus. They did very well to keep their numbers low. Now we're seeing a surge. They are saying it is because of the Delta variant. Is it mainly because of this, do you think, or the slow vaccination rates in those countries?
So they have done very well in the past, many Asian countries, to avoid the spreading of the virus. Now there is a Delta variant that is most transmissible. And so those public measures that need to be put in place need to be put back in place. And many of these countries are doing very well in reimposing them early on. Problem for some of the Asian countries that they didn't move very fast as many other Western countries in the vaccination. So they are now more susceptible to the virus. Hence, the norm here, the rule here is vaccinate population as fast as you can, and then impose public health measures early on to avoid major spread of the virus.
Vaccinate populations and keep everyone safe. Dr. Capobianco, live to us there from Geneva. Great to get your insight. Thank you.